What are the key ethical considerations when performing euthanasia on an animal, and how should a veterinary nurse address these considerations while ensuring animal welfare? Answer: the ethical considerations in euthanasia involve a balance between compassion for the animal and respect for the owner's wishes, while also adhering to professional and legal guidelines. Animal welfare: the nurse must ensure that the euthanasia process is conducted humanely, causing minimal distress to the animal. This includes using appropriate drugs, ensuring a quiet and calm environment, and confirming the animal's death with a secondary method, such as checking the heartbeat, to ensure that no suffering occurs. Client considerations: the veterinary nurse must explain the process to the client, allowing them to make informed decisions. The nurse should support the owner through the emotional process, providing empathy while also maintaining professional boundaries. Legal requirements: consent forms must be properly documented as required by law to ensure that the procedure is carried out with the owner's informed consent. These forms should outline the reason for euthanasia, the method used, and any costs associated with the procedure. Resource allocation: in cases where there are multiple animals requiring care, the nurse must follow ethical guidelines in prioritizing care. What is the purpose of maintaining detailed records of euthanasia procedures, and what should these records include to comply with legal and professional standards? Answer: detailed euthanasia records are crucial for both legal and professional reasons. Legal compliance: in many jurisdictions, euthanasia is regulated under animal welfare and veterinary laws. These records serve as proof that the procedure was carried out with proper consent and in accordance with legal and ethical standards. Documentation also helps to ensure that the euthanasia was justified and performed humanely. Record contents: the records must include client details, full name and contact information of the animal's owner, animal details, identification of the animal including species, breed, age, and medical history, consent, written or verbal consent from the owner outlining the decision to euthanize, the reasons and the understanding of the procedure, euthanasia method, the drugs used and the dosages, as well as any secondary verification of death, e.g. listening for heartbeats, checking for breathing, date and time, exact date and time of euthanasia, and confirmation of death. Veterinary nurse and veterinarian involvement: the signatures of the veterinary nurse and the veterinarian who carried out the procedure, along with any notes on the process. Mr. Thompson has just brought his elderly dog Max into your veterinary clinic. After thorough examination, the veterinarian recommends euthanasia due to the dog's terminal illness and severe pain. Mr. Thompson is emotionally distressed but agrees to proceed with euthanasia. As a veterinary nurse, what are your responsibilities in this situation, and how should you proceed to ensure both legal compliance and ethical care? Answer: as a veterinary nurse, your responsibilities include ensure understanding and consent. You must ensure that Mr. Thompson fully understands the euthanasia process, including the reasons for it, the method used, and any associated costs. You should explain this in simple, compassionate terms. Prepare the environment. It's essential to create a calm and private environment for Mr. Thompson and Max. This helps reduce anxiety for both the client and the animal. You should guide Mr. Thompson through the process, offering him support as needed. Administer the procedure. Follow the veterinarian's instructions carefully when preparing and administering the euthanasia solution. Legal documentation: complete the euthanasia record, ensuring that all necessary information is documented, including the client's consent, the euthanasia method, and the details of the procedure. The euthanasia should be documented in the patient's medical history as well. Post-euthanasia care: after the procedure, check Max to ensure that the death is confirmed and support the client through the grieving process. Provide information about options for the animal's remains, such as cremation or burial. Ika Veterinary Hospital: how should a nurse manage the cleaning and disinfecting of surgical suites to prevent cross-contamination and ensure a sterile environment? Answer: proper cleaning and disinfection of surgical suites are critical for preventing the spread of infections and ensuring the safety of both animals and staff. The process includes pre-cleaning: begin by removing any visible debris, blood, or body fluids using disposable materials like wipes or paper towels. Disinfecting surfaces: use hospital-grade disinfectants approved for use in veterinary settings. The disinfectant must be effective against a broad spectrum of pathogens, including bacteria, viruses, and fungi. Follow the manufacturer's instructions for dilution ratios and contact time. Sterilizing instruments: surgical instruments must be thoroughly sterilized between uses. This can be achieved through autoclaving, which uses high-pressure steam to eliminate all microbial life. Instruments should be stored in sterile containers until they are ready for use. Special considerations: Pay attention to high-touch areas such as door handles, light switches, and counters. Staff protection. Ensure that all personnel involved in cleaning the surgical suites wear appropriate personal protective equipment (PPE) such as gloves, masks, and gowns to reduce the risk of exposure to contaminants. What are the key principles involved in managing inventory in a veterinary practice, and how should a veterinary nurse prevent both shortages and overstocking of medical supplies? Answer: effective inventory management is crucial in a veterinary practice to ensure that medical supplies are available when needed without creating waste or incurring unnecessary costs. Inventory tracking. Veterinary nurses should use an inventory management system, either manual or digital, to track the quantity and usage of supplies. This system should update in real time, especially for high-use items like medications, surgical instruments, and consumables such as bandages and syringes. Reorder levels. Establish minimum stock levels for each item based on usage history and lead times for ordering. When stock falls below this threshold, an automatic reorder process should be triggered. This helps to prevent shortages. Regular audits. Schedule regular inventory audits, e.g., weekly or monthly, to verify stock levels and ensure that records are accurate. Expiration dates. For medications and vaccines, ensure that stock is rotated and older items are used first to minimize the risk of expired products being used. Keep a separate inventory of expired or near expiry items for easy disposal. Supplier relationships. Develop strong relationships with suppliers to negotiate bulk purchasing and ensure reliable deliveries. What is the role of a veterinary nurse in managing conflicts with clients while maintaining professional boundaries, and how should a nurse respond if a client becomes overly demanding or aggressive? Answer: veterinary nurses must maintain professionalism while managing difficult client situations. The primary role is to ensure the well-being of the animal and to provide the best possible care, while also navigating challenging interactions with clients. Setting boundaries. Nurses should establish clear professional boundaries, ensuring that they do not become personally involved in the emotional aspects of the situation. Dealing with aggression. If a client becomes overly demanding or aggressive, the nurse should first try to de-escalate the situation by speaking calmly and professionally. Referral to management. If the situation cannot be resolved directly, the nurse should refer the client to the practice manager or veterinarian, who may have more authority to address the issue or negotiate a resolution. Documentation. Document any incidents of client aggression or conflict in the medical records, including the nature of the issue, the nurse's response, and any actions taken by the practice. Professional conduct standards require that veterinary staff maintain a calm and neutral stance in all interactions with clients, ensuring that personal emotions do not interfere with the provision of care. How should a veterinary nurse address a situation where diagnostic equipment, such as a radiology machine, is malfunctioning? Answer: when diagnostic equipment malfunctions, a veterinary nurse should assess the issue, determine whether the equipment is malfunctioning by checking for obvious issues such as power failures, cable disconnections, or settings errors. Troubleshoot. Follow the standard operating procedure for troubleshooting. This might include checking the machine's manual for common error codes or resetting the system. Report the problem. If the issue cannot be resolved quickly, the nurse should report the malfunction to the senior staff or maintenance team. Documentation of the issue is critical for ensuring follow-up action. Ensure patient care. While waiting for repairs, the nurse should ensure that patient care is not compromised. This may involve using alternative diagnostic methods or postponing non-urgent procedures. Proper maintenance protocols and equipment inspections should be carried out regularly to minimize the risk of equipment failure and ensure that equipment is always functioning at optimal capacity. What steps should a veterinary nurse take to ensure proper handling and disposal of medical waste in a veterinary practice? Answer: proper handling and disposal of medical waste are essential to prevent contamination and adhere to legal and environmental regulations. Segregation of waste. Different types of medical waste, e.g., sharps, infectious materials, pharmaceutical waste, should be segregated into appropriate containers. Sharps containers should be puncture-resistant and biohazard waste should be clearly labeled. Safe handling. All personnel should be trained in safe handling techniques, including the use of gloves and other PPE when disposing of waste to minimize exposure to pathogens. Disposal. Medical waste should be disposed of through licensed waste disposal services that comply with local health and environmental regulations. Hazardous waste should be handled in accordance with these regulations, ensuring that it is treated, sterilized, or incinerated as required. Documentation and compliance. The practice should maintain a record of medical waste disposal, including the types of waste and the disposal method used. Regular audits should be performed to ensure compliance with regulations. How should a veterinary nurse prioritize tasks when faced with a busy day in the clinic, including emergency cases, scheduled appointments, and administrative duties? Answer: in a busy clinic setting, prioritization is key. The nurse should assess urgency, immediately assess the situation to determine which tasks are most urgent, e.g. emergency cases, and which can be deferred, e.g. routine administrative work, delegate tasks. If possible, delegate non-urgent tasks to other staff members. This allows the nurse to focus on high-priority activities such as preparing for surgery or assisting the veterinarian with complex procedures. Stay organized. Keep a detailed to-do list or use a scheduling tool to ensure that important tasks, such as medication administration or client follow-up, are completed on time. Maintain communication. Regularly update the veterinarian and other team members on the progress of tasks to ensure that no critical aspect of patient care is overlooked. Time management and communication skills are essential to ensuring that the clinic runs smoothly even during busy periods. What are the key considerations for a veterinary nurse when tracking inventory for medical supplies, and what are the potential risks of poor inventory management? Answer: the key considerations include tracking usage. Carefully track the usage of supplies to ensure that stock levels are replenished in time. Expiration dates. Monitor expiration dates to avoid using expired medications or vaccines. Minimizing waste. Overstocking can lead to waste, especially with perishable items. Overstocking can also cause storage problems, while understocking can lead to shortages and delays in care. Poor inventory management risks include increased costs, the inability to provide necessary care during emergencies, and the waste of resources due to expired items. What is the primary purpose of aseptic techniques in a surgical setting, and what are the key steps to ensure sterility during a procedure? Answer: the primary purpose of aseptic techniques is to prevent the introduction of pathogens into the surgical site, reducing the risk of infection. This is critical in veterinary surgery to ensure the health and safety of the patient. Key steps to ensure sterility: preparation of the surgical site, shave and clean the area with antiseptic solutions, e.g. chlorhexidine, iodine, sterile equipment and instruments. All instruments should be autoclaved and kept in sterile packs until used. Surgical attire. Staff must wear sterile gloves, gowns, caps, and masks. Sterile field maintenance. Drapes must be used to create a sterile field and contamination should be avoided. Instruments or personnel breaking sterility must be re-sterilized or replaced immediately. Hand hygiene. Use an appropriate surgical scrub to remove transient and resident flora from hands and arms. Dr. Patel is performing an orthopedic surgery on a dog with a fractured tibia. During the procedure, the scrub nurse accidentally touches the sterile surgical field with her ungloved hand. What should the surgical team do next to ensure the sterility of the procedure? Answer: in this scenario, the following steps should be taken immediately. Stop the procedure. Pause the surgery momentarily to assess the contamination. Replace contaminated items. The affected part of the sterile field, including drapes and instruments, must be replaced with sterile materials. Hand hygiene and gloving. The scrub nurse must re-scrub and don a new pair of sterile gloves. Continue with aseptic technique. Ensure the team is vigilant to avoid further breaches of sterility. Relevant rule. The Australian Health Facility Guidelines recommend that any contamination of the sterile field must be addressed immediately to mitigate infection risks. What is the role of the scrub nurse in maintaining aseptic conditions during a surgical procedure? Answer: the scrub nurse plays a critical role in maintaining aseptic conditions by preparing instruments, ensuring all instruments are sterile and properly arranged, passing instruments, providing instruments to the surgeon in a manner that maintains sterility, monitoring sterile field, observing the surgical field to identify and correct any breaches in sterility, supporting the surgical team, assisting with dressing changes, suction and retraction without compromising asepsis. Relevant regulation. Veterinary Surgeons Regulation 2012 mandates that all assisting staff be adequately trained in aseptic techniques to maintain high standards of veterinary care. What precautions should be taken to minimize radiation exposure when performing diagnostic imaging, particularly for thoracic radiographs? Answer: to minimize radiation exposure, protective equipment, use lead aprons, thyroid collars, and lead gloves. Dosimetry monitoring. Staff should wear dosimeters to track exposure, distance and shielding. Maintain a safe distance from the X-ray beam and use protective barriers. Patient positioning. Correct positioning reduces the need for repeated exposures. Collimation. Restrict the X-ray beam to the area of interest to limit scatter radiation. Relevant regulation. Radiation Safety Act 1999 outlines requirements for protective measures and dosimetry in veterinary practices. A cat requiring abdominal radiographs is highly uncooperative, making standard positioning difficult. The technician is considering manual restraint without protective barriers. What are the risks associated with this approach, and what alternative strategies can be employed? Answer: risks of manual restraint without protection, increased radiation exposure to the handler, non-compliance with safety regulations, such as the Radiation Safety Regulation 2021, potential harm to the handler or animal due to stress or injury. Alternative strategies: chemical restraint, use sedation to calm the animal, positioning devices, utilize sandbags, foam wedges, or tape to secure the animal, remote exposure, operate the imaging equipment from a shielded area. Relevant guidelines: the Australian Radiation Protection and Nuclear Safety Agency (ARPANSA) advises against manual restraint without protective measures unless absolutely necessary and requires clear documentation if used. Explain the principle of ultrasonography and how it differs from radiography in veterinary diagnostics. Answer: ultrasonography uses high-frequency sound waves to create images of internal structures. Unlike radiography, which uses ionizing radiation, ultrasonography is safer for repetitive use and suitable for soft tissue imaging. Key differences: energy source, sound waves, ultrasound versus X-rays, radiography, tissue contrast. Ultrasound provides detailed images of soft tissues, while radiography is better for bones and dense structures. Safety: ultrasonography poses no radiation risk, making it safer for pregnant animals and repeated exams. Relevant regulation: Animal Care and Protection Act 2001 ensures diagnostic tools are used ethically and safely in veterinary medicine. What is the significance of collimation in radiographic imaging, and how does it improve the quality of diagnostic images? Answer: collimation is the process of narrowing the X-ray beam to the area of interest, and it plays a critical role in enhancing both the quality of the diagnostic image and the safety of the procedure. By restricting the beam, collimation helps to reduce the amount of scatter radiation that reaches the patient and the radiograph, which results in a clearer image with better contrast. This is particularly important in veterinary imaging, where soft tissue and bone differentiation is essential. The reduction of scatter radiation also prevents unnecessary exposure to surrounding tissues, reducing the overall radiation dose to the patient. In addition, collimation improves diagnostic accuracy by ensuring that the X-ray beam is focused only on the area of interest, minimizing image blur and noise that could lead to misinterpretation. Proper collimation is a critical component of producing high-quality radiographs that are essential for accurate diagnosis. Relevant standard: according to the Code of Practice for the use of veterinary X-ray equipment, collimation must be used to optimize image quality and reduce radiation exposure in line with the principles of ALARA as low as reasonably achievable. Lee is performing a radiograph on a Labrador Retriever with suspected hip dysplasia. However, the dog's large size makes proper positioning on the radiographic table challenging. What techniques can Lee use to ensure accurate positioning and a high-quality diagnostic image? Answer: Lee can employ several techniques to ensure the Labrador Retriever is positioned accurately and the radiographic image is of high quality. Adjustable table height: use a table with adjustable height to accommodate the dog's size, ensuring a proper angle and better control over positioning. Positioning aids: use foam pads, wedges, or sandbags to help stabilize the dog's position without causing discomfort or injury. These aids are particularly useful for securing limbs or preventing unnecessary movement during imaging. Two-person assistance: given the dog's large size, Lee could ask for assistance from a second person to help hold and stabilize the animal while the positioning is fine-tuned. The assistant should also maintain a safe distance from the X-ray beam. Proper sedation: if necessary, moderate sedation can be used to reduce anxiety or movement in the animal, especially if the dog is highly uncooperative. This ensures minimal motion during the radiograph and enhances image clarity. Relevant guidelines: the Australian Radiation Protection and Nuclear Safety Agency (ARPANSA) recommends proper positioning aids and, if needed, sedation to ensure safety, accuracy, and image quality during radiographic procedures. Describe the process of preparing a surgical pack and the importance of each step in maintaining sterility. Answer: preparing a surgical pack is crucial for ensuring a sterile environment during veterinary procedures. The process involves several key steps. Cleaning instruments: all surgical instruments must be thoroughly cleaned and inspected for damage before sterilization. This ensures that no debris or residues are left on the instruments, preventing infection. Packing instruments: Instruments are logically arranged in the pack. Heavier items should be placed at the bottom, while smaller and more delicate tools should be on top to avoid contamination. Wrapping. The pack should be wrapped in autoclave-compatible material, such as muslin or sterilization wrap, which ensures that the instruments remain sterile after being autoclaved. Sterilization. The wrap pack is then sterilized, typically through autoclaving, which involves heating the pack to 120 undic for 15-20 minutes under high pressure to kill microorganisms. Storage. Once sterilized, the pack should be stored in a clean, dry, and sterile environment until it is ready for use. This minimizes the risk of contamination. What are the potential risks of improper monitoring during post-operative recovery, and how can these be mitigated? Answer: improper monitoring during post-operative recovery can result in several risks for the patient, including undetected pain. If pain is not adequately managed, it can lead to distress, delay recovery, or even complications such as wound dehiscence, infection. Failure to monitor the surgical site properly can lead to undiagnosed infections, which may escalate into serious conditions if untreated. Respiratory or cardiovascular complications. Anesthesia can affect vital organs, and inadequate monitoring may fail to identify issues like hypoxia, bradycardia, or hypotension, leading to life-threatening situations. To mitigate these risks, regular monitoring. Vital signs including temperature, heart rate, and respiratory rate should be checked regularly to detect any deviations from normal. Pain management. Administer prescribed analgesics as per the veterinarian's instructions, ensuring pain relief is managed throughout the recovery phase. Wound care. Frequent inspections of the surgical site should be conducted to monitor for signs of infection such as redness, swelling, or discharge. A 6-year-old male Labrador Retriever is brought to the clinic with a body condition score (BCS) of 9, and has been diagnosed with early-stage chronic kidney disease (CKD). The owner feeds the dog a high-protein diet meant for active working dogs. Explain why this diet is inappropriate and recommend dietary adjustments. Discuss the role of macronutrients in managing CKD. Answer: a high-protein diet is inappropriate for a dog with CKD because excessive protein can lead to increased nitrogenous waste products, which the kidneys struggle to excrete. This exacerbates the clinical signs of uremia, such as nausea and lethargy. Dietary adjustments should include protein, moderate, high-quality protein to reduce waste production while meeting the dog's essential amino acid needs. Fat, increased fat to provide energy and maintain body weight without overburdening the kidneys. Carbohydrates, adequate carbohydrates for energy as they do not contribute to nitrogenous waste. Phosphorus, restricted to slow the progression of kidney damage. Omega-3 fatty acids, anti-inflammatory effects may improve renal perfusion and reduce proteinuria. Relevant guidelines. Follow the World Small Animal Veterinary Association (WIVA) Global Nutrition Guidelines. MS. Carter's 3-year-old Persian cat Bella is due to deliver kitten soon. Bella starts showing signs of distress, including unproductive straining for over an hour and a greenish vaginal discharge without delivering any kittens. MS. Carter contacts your clinic. What should MS. Carter do, and how should you as a veterinary nurse assist in managing this emergency? Answer: Bella's symptoms suggest dystocia, which can be life-threatening. MS. Carter should be advised to bring Bella to the clinic immediately. Veterinary nurse actions. Triage. Gather detailed history, including the duration of labor, the timing of the discharge, and Bella's overall condition, appetite, activity level, prior scans. Initial assessment. Monitor vital signs, temperature, heart rate, respiratory rate. Prepare for diagnostics like radiography or ultrasound to identify obstruction or fetal distress. Supportive care. Administer oxygen therapy if needed. Set up for intravenous fluids to stabilize Bella if she is in shock. Relevant guidelines. The Australian Veterinary Emergency and Critical Care Manual recommends immediate intervention in cases of prolonged unproductive labor or abnormal discharge. What are the key differences between tube feeding and syringe feeding in small animals, and in what scenarios would each be indicated? Answer: tube feeding indications: animals with prolonged anorexia, esophageal disorders, or those unable to consume food voluntarily. Method: a feeding tube nasosophageal, esophagostomy, or gastrostomy is placed. Advantages: continuous delivery of nutrients, bypassing oral cavity suitable for long-term feeding. Challenges: requires sedation, anesthesia for placement, risk of aspiration pneumonia if mismanaged. Syringe feeding indications: short-term feeding support for animals with mild anorexia or during recovery from minor illnesses or surgery. Method: Nutrient-dense liquid food is gently syringed into the mouth. Advantages: non-invasive and easy for short-term management. Challenges: can cause stress or aspiration if the animal resists. Explain the physiological stages of the estrus cycle in dogs and their significance in breeding management. Answer: the canine estrus cycle has 4 stages: prostrus, duration, 9-1-2 days, signs: swollen vulva, bloody discharge, attraction to males but no mating, hormones, rising estrogen levels, estrus, duration, 5-9 days, signs: clear discharge, receptivity to males, hormones, estrogen decreases, LH surge induces ovulation, breeding timing, best time for mating or artificial insemination, 4-8-7-2 hours post LH surge, destrus, duration, 60-90 days, signs: non-receptive behavior, hormones, progesterone dominance, regardless of pregnancy, anestrus, duration, 4-6 months, significance, resting phase for the reproductive system. Mr. Patel's senior cat Luna has been diagnosed with hepatic lipidosis following a week of anorexia due to stress. Mr. Patel is concerned about the feeding method and nutritional recovery plan. What should the veterinary team recommend? Answer: key steps in managing hepatic lipidosis. Feeding method: esophagostomy tube feeding is ideal for long-term feeding as it minimizes stress and ensures adequate caloric intake. Gradual introduction of calories to avoid refeeding syndrome. Dietary composition: protein, high-quality protein to support liver function but avoid excess ammonia production. Fat, moderate fat content to prevent exacerbation of liver stress. Carbohydrates: easily digestible carbohydrates to provide energy. Include vitamin B, thiamine, and taurine supplementation. Monitoring: regularly assess weight, hydration status, and liver enzyme levels. Relevant guidelines: the American College of Veterinary Internal Medicine (ACVIM) recommends nutritional intervention within 48 hours of diagnosis to prevent progression. How does feeding a hypoallergenic diet help manage food allergies in animals, and what are the essential components of such a diet? Answer: hypoallergenic diets are specifically formulated for animals with food allergies or intolerances. These diets help by reducing the potential for allergic reactions, which are typically caused by common proteins or carbohydrates. Key components of a hypoallergenic diet: novel proteins, proteins that the animal has not been exposed to before, g. duck, venison, or kangaroo, to avoid triggering immune responses from common allergens like chicken or beef. Hydrolyzed proteins, proteins that are broken down into smaller pieces, which are less likely to trigger an allergic response. Carbohydrates, often simple and easily digestible, such as rice or potatoes, to avoid common allergens like corn, wheat, or soy. Limited ingredient diets that contain fewer ingredients to minimize the risk of allergens. Indications for hypoallergenic diets: animals with chronic gastrointestinal or dermatologic signs that have been unresponsive to other treatments. Diagnosed food allergies based on elimination trials. What are the main causes of pyometra in dogs and cats, and how should it be managed as an emergency condition? Answer: pyometra is a potentially life-threatening infection of the uterus, most commonly occurring in intact female dogs and cats. It is often seen after the estrous cycle when hormonal changes, particularly elevated progesterone, predispose the uterus to bacterial infection. Causes of pyometra: hormonal influence, prolonged exposure to estrogen and progesterone during the estrous cycle. After mating or during a prolonged luteal phase, the endometrial lining thickens and becomes more susceptible to infection. Bacterial infections: the most common bacteria involved is Escherichia coli, which proliferates in the uterus during the luteal phase. Clinical signs: pus-like vaginal discharge in open pyometra, lethargy, anorexia, vomiting, and abdominal distension in closed pyometra, fever and dehydration in severe cases. Management: surgical intervention. Ovariohysterectomy, spaying, is the treatment of choice and is curative. This surgery is performed as an emergency procedure. Medical management: if surgery is not immediately feasible, medical management with antibiotics, e.g. amoxicillin, cavulanate, and prostaglandins to induce uterine contraction can be attempted, though this is not recommended for long-term management. Relevant guidelines: the Australian Veterinary Association either provides recommendations for the emergency management of pyometra, emphasizing the importance of early diagnosis and rapid intervention to prevent sepsis and organ failure. How does weight management in obese animals contribute to the treatment of osteoarthritis, and what specific dietary recommendations should be followed? Answer: obesity is a significant risk factor for the development and progression of osteoarthritis in animals. Extra body weight places additional stress on joints, exacerbating the symptoms of OA and increasing inflammation. Weight loss can help reduce joint strain, alleviate pain, and improve mobility. Key aspects of weight management in OA: calorie control. Provide a caloric intake that promotes gradual, controlled weight loss, typically 1–2% of body weight per week. Use a high-fiber, low-fat diet to promote satiety and reduce overall calorie intake. Omega-3 fatty acids. Supplementation with omega-3 fatty acids, e.g., fish oil, can reduce inflammation in the joints, helping to manage OA symptoms. Protein quality. A high-quality protein source should be maintained to preserve lean muscle mass during weight loss. Carbohydrates include complex carbohydrates like sweet potatoes and rice, which provide steady energy release without contributing to excess fat accumulation. Mr. Thompson owns a mixed-breed dog named Max, who has been mating with a female dog for several cycles without successful pregnancy. After discussing with a veterinarian, it suggested to use artificial insemination (AI). Explain the different methods of artificial insemination and when each method should be used in canine breeding. Answer: artificial insemination (AI) is used when natural mating is unsuccessful or when breeding management requires precise control over timing or genetic material. In dogs, 3 methods of AI are commonly used. Transcervical insemination (TCA), most commonly used in dogs. Sperm is deposited directly into the cervix using a catheter, which can be performed without general anesthesia, indicated for situations where natural mating is difficult or the dog is reluctant to mate. Surgical insemination (C). Sperm is deposited directly into the uterus through a surgical procedure under anesthesia, indicated when TCI is unsuccessful or when there are anatomical issues, e.g. narrow cervix. Intrauterine insemination (IUI), a method where sperm is directly injected into the uterus via a catheter, indicated when the female has reproductive tract issues such as infections or when there is male infertility. How do nutrient deficiencies and excesses affect the growth and development of puppies, and what are the dietary guidelines for puppies to ensure optimal growth? Answer: proper nutrition is critical for the growth and development of puppies. Nutrient deficiencies or excesses can have serious long-term effects, including skeletal abnormalities, organ dysfunction, or developmental delays. Key nutrients for puppies: protein, essential for muscle development and overall growth. Puppy diets should have higher protein levels than adult diets to support tissue formation and repair. Excess protein can lead to kidney strain, but a lack of protein can stunt growth. Fat provides energy and supports the development of the nervous system. Omega-3 fatty acids (DHA, EPA) are especially important for brain development. Excess fat can lead to obesity, while insufficient fat can result in poor coat quality and slow growth. Calcium and phosphorus. Balanced levels of calcium and phosphorus are necessary for proper bone development. Excess calcium can lead to skeletal issues, e.g. hip dysplasia, while deficient calcium can cause rickets or poor bone mineralization. Vitamins and minerals. Vitamins A, D, and E, as well as minerals like zinc and iron, are important for immunity and cellular functions. Excessive vitamin can cause toxicity, while insufficient zinc can impair immune function.